human emotions. We're up, we're down. It's a natural cycle. But what happens when that cycle snaps?
Hi, I'm Kat Carney. This show is about depression, a disorder that can affect anybody. 100 years ago, they called it melancholy, and it was treated here, the psych ward of an old state hospital. Back then, if you were depressed, you could end up here. Almost 19 million Americans will become depressed this year. For most of us, depression is a mood that comes and then goes. But for some people, this mood lingers and becomes a disease. Today, depression is treated with new medications and new therapies. So join me as I explore the mysteries of this often misunderstood illness.
Depression can be life-threatening. In the worst cases, if untreated or ignored, it can drive people to despair. When hope vanishes, depression can lead to suicide.
Sir, can you hear me? Can you open your eyes?
Dr. Octavio Diaz is always on the lookout for depression.
So, Kathy, he has a history of depression?
We asked for medical history.
Mania, postpartum, dysthymia. Depression has many faces, but sometimes the symptoms are hidden.
It's very easy when a patient comes in after slicing their wrists and saying they're going to kill themselves because they're depressed. But it's extremely hard for us to identify a patient that comes into the emergency department with abdominal pain, and in reality, he or she may just be depressed.
100/56.
For every patient in the ER, Dr. Diaz does a physical and mental assessment.
If we don't pick up the clues and identify the patient appropriately, that patient may then go down the road of severe depression, where treatment will then be far more difficult. So as good healthcare professionals in the emergency department, we need to recognize the clues.
Suicide is the end of the road for depression, but it doesn't have to be this way. The vast majority of people who seek treatment improve dramatically.
It's very important that if you have a family member that you suspect has a depressive disorder, it's important for you to give this information to the emergency team.
He's had some past suicide attempts, one other by pills.
We know for a fact that he's had some overdoses. Some charcoal with sorbitol, we're going to write down the NGP, please.
Mental illnesses like depression don't show up on an X-ray or a blood test, but that doesn't mean doctors can't diagnose it. Actually, they use a list of symptoms in here to identify the illness. DSM-4, the Diagnostic Handbook for All Mental Illness, lists a group of symptoms that indicate depression. Are you having feelings of hopelessness or difficulty making decisions? Is there a radical change in eating and sleeping habits or a loss of interest in a long-time hobby or everyday responsibilities? Are you unable to focus at work, or are you consumed by thoughts of death, desperation, or suicide? Having any one or all of these for more than 2 weeks suggests clinical depression is lurking. Okay, depression is more than a mood. It's an illness. But what triggers this illness? Why do some people get it and others not? Well, the answer is we don't really know, because the causes of depression are very complex. Life events play an unpredictable role. Out in the hills of western Massachusetts is a man who knows money won't buy you happiness.
Hey, horse.
Gordon Russ is about to experience life's greatest highs and lows. His story takes us to the edge of depression, where normal emotions become clinical illness. It begins when he wins the state lottery.
The notion of becoming an instant multimillionaire was both appealing, but it was also frightening.
Gordon worried how money would change him. What he didn't realize was how quickly on the heels of great fortune, great tragedy would follow. 2 weeks later at his birthday party, Gordon's best friend Rick, a stunt pilot, performs an air show.
On Rick's last pass over the party, he did a snap roll with really insufficient altitude and hit a tree and crashed and died and burned up in a ball of flame. It was a horrible, horrible ending. I remember waking up the next morning thinking that it was all just a bad dream, that really didn't happen.
Gordon was at a crossroads. His mental health was in jeopardy.
There was certainly huge, huge grief. Personally, I was in shambles.
Grief is a normal response to emotional trauma, but in some cases, for reasons doctors don't fully understand, grief can also trigger clinical depression.
I needed to let go, and you couldn't cry in the office. Where do you cry? So I would come out and let go.
Doctors believe many cases of clinical depression are a complex interaction of life events, genetics, and brain chemistry. When Gordon won the lottery and lost his best friend, it was this strange twist of life events that caused him to lose his way.
I didn't know where I was headed next, and that was scary.
Gordon struggled with his emotions, but he was not consumed by them. This is the difference between the mood depression and the illness.
Okay, because we can make it work.
Gordon was lucky. Life events took him to the edge of clinical depression, but no further. With the aid of family and friends, Gordon regained his emotional footing, even if the memories of his loss remain.
The sound of the wind whistling through the trees always reminds me of the aftermath of that crash, because I would be outside here grieving and I would hear the wind whistling, and that's going to be there forever.
Misfortune can strike any of us, so here are some things you can do to keep from becoming depressed. Stay active. Eat a balanced diet. Keep in touch with friends. Learn new skills. Find time to relax. And don't be ashamed to ask for help if you need it. There's nothing weak about needing somebody to talk to. Evie Barkin has struggled with depression her entire life.
I didn't enjoy things like other children did. I just felt that there was something unusual because I was not happy.
Experts believe depression is caused by a combination of factors. Genetics or family history can make people susceptible to the illness. Chemical imbalances in the brain often contribute to depression. And life events like tragedy, loss, or emotional abuse can spark depression in any of us. Current research suggests most cases of depression are some combination of all three.
I was crying a lot, and I didn't like things, and things that I ordinarily used to like. I never really loved anything.
Evie's depression went undiagnosed for years. She turned to diet pills, which contained a stimulant to boost her energy.
They gave me a false high, but they also helped me to focus. And they gave me a lot of energy, so I was able to do a lot of different things. But my mood was never stable.
Evie had many symptoms of clinical depression: disinterest, isolation, and overwhelming feelings of guilt and worthlessness. When federal laws changed and diet pills were no longer available over the counter, Evie slipped off of them and into a major depressive episode.
I was literally sick. I was non-functional. I couldn't get out of bed. I would sit in my living room and stare at the walls. I would go to the movies. I would fall asleep in a movie. Nothing was right. Everything was bad. It was like, I couldn't enjoy anything.
Evie wasn't just sad. Her body was under siege. She had chronic stomach aches, back problems, a sleep disorder. This was much more than just emotions. It was a disease.
I had lost my job, my father had died, and I was just getting more depressed, and everything seemed to be going downhill, and I just didn't want to live.
Inside Evie's brain, scientists believe a chemical imbalance changes how a depressed person thinks. Our brain cells communicate with each other through electrical impulses. These impulses are messages sent from one cell to another. Normally, the impulse is carried across a small gap called the synapse by a chemical messenger called a neurotransmitter. For unknown reasons, people who are depressed have diminished amounts of the neurotransmitter serotonin. This shortage means critical mood-controlling messages fail to get communicated. In short, the message is sent but never received. Scientists believe this is the biochemical basis of depression. Evie's desperation led to a suicide attempt. She was hospitalized and began to receive treatment. Antidepressant medications were prescribed. Evie spent the next several years trying different medications until 1987, when a drug called Prozac became available. Prozac belongs to a group of antidepressants called selective serotonin reuptake inhibitors, or SSRIs for short. SSRIs work on the brain by improving the performance of the neurotransmitters. They increase the amount of serotonin by slowing how quickly it returns to the sending neuron. More serotonin means a greater chance the message will pass successfully from one brain cell to another. Prozac changed Evie's life dramatically. She discovered something she'd never known: life without depression.
I started feeling things differently. I mean, I noticed colors more. I started enjoying things a little. I went to visit a friend in South Carolina for the weekend, and I had the best vacation I ever had. Just feeling positive about everything. It would feel good to get up and look outside, and if it was a sunny day, say, gee, it feels good to be alive.
Medication has become the first line of treatment for depression. A 1997 pharmaceutical marketing study found 3 of the top 10 best-selling drugs nationwide were antidepressants. At the same time, some critics claim drugs for depression are overprescribed.
Hi.
I wanted to find out more, so I visited Sophie McIntyre, a neighborhood pharmacist.
There are several medications used to treat depression. Currently, most of the people who have depression are treated with an SSRI, such as there's medications like Zoloft, Paxil, Prozac are the big names.
Okay, listen. There are several different types of SSRIs. Each one affects the neurotransmitter slightly differently, but all of them have side effects, including agitation, constipation, sexual dysfunction, and stomach aches.
The main side effects that people complain about initially can be GI upset. They can have constipation or diarrhea. Some people can feel a little bit tired when they take medications. Those patients are generally advised to take them in the evening hours, whereas if the medication makes them a bit agitated or more alert, we'd recommend that they take it in the morning, because it is possible for one patient to feel drowsy from one of the medications, and then the next patient to maybe feel a little bit agitated from it.
SSRIs like Prozac and Zoloft are not happy pills. They don't make you euphoric. They restore your emotional equilibrium by repairing the chemical imbalance in your brain.
So once I get my prescription, I just pop one of the pills and I'm going to instantly feel better?
No, unfortunately not. Depression takes a while to be treated. Most of the medications take about 4 to 6 weeks before it kicks into your system.
4 to 6 weeks?
Absolutely.
Do a lot of people give up? I think I would probably give up if I didn't feel better, at least after 2 weeks. That just sounds like a lot of medication.
It is. In fact, I can show you a comparison of how many pills somebody would take for an ear infection compared to how many pills somebody might need for treating depression. I have 3 different examples here for you.
Okay.
This first one is a medication that women will generally use for menstrual cramps, or if people have headaches, for example. One pill might take away their pain.
I take that pill. It does work. It works very quickly.
And this medication here is used for either ear infections or strep throat, some type of infection.
So that's like an antibiotic.
Exactly. 6 pills here make the infection go away.
Knocks it out.
A patient who has depression probably take 1 or 2 of those a day for 4 to 6 weeks before they even feel any effect.
That's a lot of pills, and that's a long time.
It is.
So I guess it really is important for people not to give up.
Very important.
Do you remember the first time you thought to yourself, I'm depressed? Chances are you were in high school.
If you're sad, then nobody wants to be around you.
It can just completely change who you are. She just denies it every time someone asks her.
Life as an adolescent can be overwhelming.
You're just not aware of what they're going through.
Roughly 500,000 teenagers will attempt suicide this year. Almost 5,000 will succeed.
When you're depressed, nobody and nothing is going to make you that much happier.
30 years ago, depression was considered an adult illness. Today, we realize depression affects nearly 5% of the adolescent population.
What I see as a physician a lot of the time, though, is young people who aren't very communicative with friends, aren't necessarily having a great time at school, aren't necessarily having a great time at home. And then when you start to talk to them about their feelings, it becomes pretty evident that they're becoming very isolated.
Many teens are reluctant to share their feelings. Their silence can contribute to the problem.
You've got to sort of try to get a sense of where they're at. And I think that's difficult because sort of the classic response from a teenager is fine, or, you know, the one-word response.
If you're the parent of a teenager, what are the warning signs? Is it easy to tell the difference between normal teenage moodiness and something that might need treatment?
If you're seeing real shifts in the person's behavior, you know, for example, if the young person always does something that seems to make them happy and somehow now that's not in their life. Playing a computer game, or that could be talking to a certain friend, or that could be playing a sport, and all of a sudden they're not involved with that. Certainly there is chronic depression in young people.
Other symptoms include violent behavior, changes in sleeping patterns, a drop in academic performance, or withdrawal from friends. Brian Reuter is a teenager who struggles with depression.
I didn't want to let my parents down by letting them know I was unhappy. So up until I first became depressed, I hid from them any kind of unhappiness. I told them I was doing great, everything was fine.
When Brian began his junior year, he was a model student athlete.
I'd come back to school in the fall, played football, and it had really gotten me back into school again. And whenever that ended, it was just like everything, you know, my whole sort of structure was gone from my life.
After a breakup with his girlfriend, Brian began to feel and act differently.
What I felt was different than just feeling, you know, unhappy that, you know, I had broken up. It was more of a, you know, just not being able to function anymore.
Brian maintained good grades, but his parents noticed he was losing interest in friends and sports.
School had been so stressful, and, you know, I had been having so many troubles with relationships that year that I just wanted to take a break from it.
Brian needed help. A family doctor prescribed antidepressant medication.
I was very much against it. I didn't think it would help at all. I didn't want some drug altering my mind. It was really what it was. I wanted to get through things on my own. I didn't want to become dependent on a drug. There were a lot of reasons.
Drugs like Prozac and Zoloft and other SSRIs only work for about 65% of the people who use them. They didn't help Brian. In fact, they may have contributed to his erratic behavior at school, including a loud outburst in the school cafeteria.
I went to my school's health center and, you know, asked if I could leave, and they said, sure. They said they thought it was a good idea. So I decided to leave for about a week. What was different was they decided after a week that they didn't want me to come back for the rest of the year. They thought it was safer if I stayed out so I didn't come back and have trouble again.
Brian's family turned to the talking cure, a form of treatment called psychotherapy. But Brian had some resistance.
I felt like I should be dealing with it on my own. I didn't want people to know that I was, you know, seeing somebody for everything. I didn't want some adult knowing everything about my life.
Like many people, Brian had the wrong impression about what therapy really is.
I sort of pictured it, you know, the way a lot of people do, with lying on a couch and just telling everything about my childhood and somebody saying, okay, this is what you have, this is what you have to do.
There are many different kinds of psychotherapy, but they fall into two broad categories. Psychodynamic therapy, the most famous kind being Freudian analysis, looks back on past traumas or emotional loss to understand the present. Behavior therapy concentrates on changing negative patterns of behavior or thought that contribute to depression. Today, most therapists draw on a combination of techniques. Brian started an intensive behavioral program that met 5 days a week.
They would listen, and through my talking, I could sort out in my own mind what I was saying and what was really going on.
Therapy can help change a person's hopeless and negative thinking. It provides guidance for adjusting to changes in life. It helped Brian return to the path of mental health.
Talking to a therapist is not giving up and saying, I need your help. A therapist is a guide, somebody who can help you figure out for yourself what's best for you.
Gee, which color do I feel drawn to today?
I gotta tell you, I'm drawn to that green one right on top.
Like this one?
Yeah,
right
I like
here?
that one. In the therapeutic setting, there are many ways to express our emotions. Laurie Rappaport, a licensed therapist, surprises me with an approach called expressive arts therapy.
First, I teach people to just make a shape. And for people who don't know how to start, I might say, so can you make a wavy line? Or then I say, when people use the arts and creativity, it helps them access a part of themselves that's really vital and lively. And when you're depressed, that's one of the things that is kind of missing.
It looks kind of like DNA. Doesn't it?
There's some element of fun to it. So while it's fun, or it can be fun, it can also help reach the deeper feelings inside, or the sadness, or the fear, or the pain, or the loss.
This is also kind of focusing.
And how does that feel?
Oh, it feels very calm, actually.
Yeah.
I'm forgetting that you're there. Art therapy can be combined with other forms of treatment. It is especially effective for children and teenagers who tend to have problems verbalizing their emotions.
With someone who has depression, you could actually ask them to kind of sense, what is the feeling of the depression? What does it look like? What color is it? What shape is it?
Laurie shows me several drawings that illustrate a patient's healing journey.
So this first one, you can see her down here where she's so little, next to this darkness. And then the big word, help me. This is the middle where more of the kind of darkness is coming out, and it's being put onto the paper. And this one was a drawing of kind of helping get some of the anger that she had inside out. You can literally see the changes that happen over time. So it's a way of transforming sometimes those ugly feelings into something that becomes beautiful.
Expressive arts therapy, which was developed in the 1970s by artists working in state mental hospitals, actually draws on a long tradition of using the arts, drawing, movement, and music for healing.
Oh, wait, I gotta play. Is this a rain stick?
That's a rain stick. In expressive arts therapy, we find ways to give voice to feelings. It's a way to take the energy that's inside and then move it. And that helps the healing process happen.
That's a waterfall is what that is.
Right. Like, what's the feeling of feeling depressed? Maybe
For me, it would just be silent.
it would be silent. So then that's what we would do. In a therapy session, what's most important is that the patient feels safe. The client-therapist relationship comes first. The methods and all of that come next. You kind of felt it, didn't you? Yeah. And that's what.
I like that.
Yeah.
I like the way it kind of resonates. It has this kind of opening up feeling
Right,
to it.
right.
Every morning when I get up, there should be a
right.
gong sound. Cat is awake.
If you're looking for a therapist, here are some points to consider. What form of therapy do they practice? What's a typical session like? Approximately how long might the course of your treatment last? Do they recommend and can they prescribe medication? What type of educational background do they have to perform this therapy? What is their fee, and do they accept your health insurance? Remember, the most important question is, do you feel comfortable with this therapist? Depression can strike anybody, but women are especially vulnerable. That's right. Women experience depression at a much higher rate than men. In fact, there are certain types of depression that only women get. Every woman alive knows her hormones can be unpredictable. We're up, we're down. 1 month good, 1 month a nightmare. Now imagine what happens when raging hormones collide with depression. Sue Kearns knows. 16 years ago, she was a brand new mother. The farthest thing from her mind was depression.
At the time, when I was diagnosed and I was so sick, I couldn't even believe that I had depression. I thought I was just a bad person.
Women experience depression at twice the rate of men. Part of the reason may be the very hormones that make us women.
As a woman goes through her reproductive years, her brain sees different levels of hormones, and estrogen in particular, at different times. And that changing level, the ups and downs of estrogen in her brain, may be one of the factors that increases risk for depression in women.
Estrogen is a vital hormone, but scientists aren't sure how it contributes to depression. After childbirth, it may have been a cascade of hormones that sent Sue into a tailspin.
I don't think I realized how away from my usual self I was at that time.
Sue was enduring postpartum depression, a condition that strikes approximately 10 to 20% of new mothers. Postpartum attacks women when they should be filled with joy.
Postpartum women who are depressed typically have tremendous anxiety. They suffer from tremendous doubt and worry and not being able to sleep and not being able to eat and not being able to feel completely engaged or bonded with their baby.
Postpartum depression can appear up to a year after the birth of a child. Sue started showing symptoms after 4 months.
My judgments were off. My decision-making, I couldn't make decisions. Part of my feeling that I wasn't doing a good mothering job was one time just getting a list of things that babies usually do at certain months. You know, baby sits up or looks at the ball or does this or that. And I was so sure that our baby wasn't doing it. And then she had a cold and whatever, and I was inappropriate in my judgments, you know, getting my husband to, you know, let's take her to the doctors, let's do this, let's do that. And that's when I was really showing signs of spiraling down with a depression.
Sue's husband realized she was suffering and got her to the doctor. Antidepressant medications were prescribed, but there was a complication.
I was successfully breastfeeding, and that part of postpartum was a really good experience, a good bonding experience for me and the baby. And then when I had medication to take, I had to make a choice.
Sue felt that if she took medication, she'd endanger her child. But if she didn't, her own life was at risk.
The information that we have thus far has suggested that it's been safe to use these medications in breastfeeding. We've got some blood level studies which show that even though the baby's getting exposed to the medicine, they're almost always able to process it. They don't accumulate it, and they don't seem to present with major problems. If people are breastfeeding, they need to decide with their doctor about taking the medication during breastfeeding.
Sue stopped breastfeeding and started medication. She took it regularly. But like many people using antidepressant drugs for the first time, the first set of drugs were ineffective. Her condition deteriorated.
I was really out of touch with reality at the time, and I was afraid that I had hurt Megan. I was here by myself with her, and in my mind's eye, I perceived that Megan wasn't breathing, and I called the ambulance.
When the paramedics arrived, they discovered a perfectly healthy baby and a hysterical mother.
of course, the baby was fine, and Mom was the one that they were really concerned about.
Sue was promptly hospitalized. New antidepressant medication was prescribed.
This is a brain phenomenon. These are brain disorders. It's not something you willed on yourself. It's not something you're responsible for in terms of causing it, but you are responsible in terms of taking care of yourself.
16 years after her first depressive episode, Sue and her daughter have a wonderful relationship. Every woman faces a unique risk for depression. Who will get it and who won't is unknown. For Sue, medication and therapy have helped her recover emotional balance.
I've been lucky. I had 3 hospitalizations for depression in the early years of my illness, and fortunately none since 1988. So I'm very pleased that that's the case. I've been able to be maintained with medication and therapy and taking care of myself.
Struggling with feelings is what depression is all about. For men, this can be a sensitive issue. Most are uncomfortable even discussing it.
A great many men experience and express depression very differently than women do, and we simply don't see it.
Terrence Real is an author of a book on men and depression entitled, I Don't Want to Talk About It.
I like to say a man is about as likely to admit depression and ask for help as he is to ask for directions.
Barry Kingston knows how hard it is to discuss one's emotions. Like many men, he's done his best to hide his pain.
When I was 14 years old, my 16-year-old brother Wayne died about 3 days before Christmas. And it forever changed Christmas for me.
Depression that follows the death of a loved one is called situational depression. After his brother's death, Barry Kingston's life was forever changed.
I never was really able to overcome the overwhelming sense of loss and grief that I experienced every Christmas, whether I tried to prepare myself for it or not.
By any standard, Barry was successful and focused and should have been happy.
Suburban home, same wife, 2 beautiful, wonderful children. But despite that, I was depressed the whole time.
It's central to our culture's idea of masculinity that we're on top of it. And a depressed man is someone who has been brought down by feelings.
Male depression can hide behind many faces: risk-taking, abusive outbursts, or self-destructive behavior. Hard-working Barry made an enormous effort to keep his problems inside.
What I wanted to do was just crawl back into bed and pull the covers over my head and go to sleep and just be left alone.
White adult males are at the highest risk for suicide. When they try it, they usually succeed.
I was driving home from work and I had some really frightening thoughts about how out of control I felt and what I might do to myself, how I might harm myself.
This condition will not get better if it doesn't get treated. This is not a self-help condition. And it will get remarkably better if it does get treated.
Barry got help, and a combination of therapies allowed him to start dealing with his depression.
We all have stuff that gets in our way. And if a counselor, a therapist, a social worker can help you to explore some of those issues, and you can deal with them and set them aside and move on, then you'll just be further down the road towards happiness, fulfillment, and contentment.
Depression is a psychiatric success story. Between 80 and 90% of the people who seek treatment report substantial relief.
I wasn't afraid to ask for that help, and that's real critical. That's real important, because I don't think that it's something you can solve by yourself, because that's another misconception, right? Is if you're strong enough, you can beat this thing. Well, I've been strong enough, and I've managed to function through it, but I didn't beat it. I needed the assistance of 4 physicians and the trials of a dozen different drugs and combinations to deal with the issues that I deal with. What do you say?
I'm so sorry.
Okay.
Most cases of depression create feelings of sadness and despair. But one type can begin with feelings of unlimited energy, enthusiasm, and creativity. 30 years ago, Dennis Hagler, a Peace Corps volunteer stationed in Malaysia, started feeling better than well. He felt inspired.
I went from feeling very good, feeling very productive, to feeling I thought I had to be God.
Dennis was suffering from a condition called bipolar disorder, also known as manic depression.
I had a great future in front of me. I never thought in a million years that I was basically harboring a gene that would cause mental illness for the rest of my life.
They're very accomplished people. They function very well. You wouldn't know it on the street what these people are coping with. And yet, when things crash, they crash.
Mania takes many forms: wild spending, excessive talking, obsessive sexual behavior. But eventually, these activities give way and spiral into crushing depression. 15% of all people with this condition will commit suicide.
It's as if something or somebody stuck a straw in your head and sucked your spirit out.
The cycles of manic depression are unpredictable. Phases of mania can last for weeks. Depressive episodes can stretch for months or years. A naturally occurring salt called lithium is the first line of treatment. It is not an SSRI, but it does smooth out the highs and lows. Unfortunately, lithium didn't help Dennis, and a long period of trial and error with different drugs began.
The isolation is enormous. You don't want to see your friends. You don't want to see anybody. Socialization is almost impossible. So isolation, I think, is one of the main problems with depression.
As Dennis struggled with his condition, a new form of therapy emerged: support groups.
You're not acting like a normal person.
For 20 years, I was pretty much out in the cold with this, alone with this, and never met people that had it other than in the hospital. And then I saw that they were all just like me, and that they had all gone through the same things, and that we had a connection more than I've had with anybody I ever met.
It doesn't go away after
30 years after his first episode, Dennis's story reminds us even the most difficult cases of depression can improve with treatment.
You know, like it's from the inside, and you're talking about this is from the outside. And what was...
In the past, before effective medications were discovered, treatments for depression could be primitive: heavy sedation, padded cells, sometimes, in the worst cases, electric shock. Many people were simply locked up and forgotten.
I bet you think these are joysticks, don't you? Well, they're not. These are actually electrodes used in a treatment for depression that most people think is long gone: shock therapy.
Actually, electroconvulsive therapy, ECT for short, doesn't deserve a bad rap. I talked with Dr. Mike Henry at McLean Hospital and learned ECT is an effective treatment for severe cases of depression.
What exactly is convulsive therapy?
Convulsive therapy is using this machine, or a machine like this, to deliver an electrical stimulus to the brain to cause a grand mal seizure.
Though scientists don't know why, seizures seem to restore balance in the chemical makeup of the brain.
An average course of ECT is 8 to 12 treatments, generally given on a Monday, Wednesday, Friday schedule. You'll notice on these electrodes...
The procedure uses 2 paddles to deliver a carefully determined dose of electricity to induce a seizure that lasts between 20 and 150 seconds.
This is about as physiologically stressful as climbing up 4 flights of stairs.
ECT is one of the safest treatments for severe depression and mania. It is only used when medication and talk therapy have failed and when a patient's safety is at risk.
like most treatments, the earlier you get somebody who's depressed, the more effective it is.
Interestingly enough, men and women don't always need the exact same dosage.
Men have
Harder heads.
thicker skulls than women. And you've known
Heard
this.
it here. Say it again. Say it again.
Men have thicker skulls than women, and so there's more resistance to the electricity.
Ah.
This simply is proving what women have known from centuries.
The difference between men and women aside, there are side effects. Memory loss is the most significant, but full memory usually returns after the treatment cycle is complete. A great challenge facing scientists is finding ways to see depression in the human body. It's no easy task.
The brain is an organ that's locked in a solid box. An X-ray of the head basically shows you bone.
But now, advances in medical imaging are allowing researchers to see past the skull and into the brain.
Over the last 15 to 20 years, there's been a development of tools that allow you to look at the brain in a way that we never could look at it before.
Scientists are trying to see how depression affects normal brain activity.
If somebody is at risk for the disorder or is actually living through it, certain parts of the brain are probably not working the way they would in someone who's not experiencing depression.
Understanding how brains manage moods and emotions is the first step to seeing depression.
There's probably a complex circuit in the brain that has to do with how you regulate emotions, how you take in emotional content, how you put it back out, how you form opinions about people in an emotional field.
Scientists are looking for connections between behavior and brain activity.
How does somebody handle emotional tone, emotional input? You yell at me. What happens in my brain? How do I take not only the vocal content and the words and the semantics and regulate it, but what do I do with your tone? What do I do when you get angry with me? What lights up and what allows me to respond to that or handle that content?
Okay, this first scan's about 3 minutes.
To see depression in the brain, they start with an MRI scan. It provides an X-ray-like image of the brain's interior. This is the orbitofrontal lobe, an area scientists believe controls moods and emotions. Researchers can't see depression in these pictures. They extract data from the images to create graphs which illustrate what chemicals are present and active in the human brain. Results are preliminary, but one substance, choline, which is essential for the production of cell membranes, has been found in abnormally high levels in depressed teenagers. Scientists hope this discovery will lead to the Holy Grail: improved diagnosis and treatment before the disease strikes.
The hope is that you can actually get in there and correct the functioning of cells that aren't functioning.
Today, the future of treating depression is here in the laboratories of the nation's drug companies. Pharmaceutical researchers are improving existing antidepressants and discovering new ones. The focus of their work are the brain's neurotransmitters, the chemicals that carry impulses from one brain cell to another.
Some of them are very similar to adrenaline, and everyone knows about adrenaline. It obviously affects your mood. You see some type of a dangerous situation, your adrenaline goes up, you feel excited, you feel up. And that's a similar situation that occurs in depression, except the opposite.
Neurotransmitters are the chemical messengers that carry impulses from one cell to another. Serotonin is not the only one. Two others are norepinephrine and dopamine. The malfunctioning of any of these may contribute to depression. When these transmitters fail to attach to the receiving neuron, important messages controlling our moods fail to get through. Scientists are focusing on the end of the neurons, called the receptors. It is here where neurotransmitters bind and complete the circuit.
We can actually take the receptors out of their tissues in the body, put them in a petri dish or a test tube, and actually see whether or not molecules interact with those receptors. Just simply, do they grab onto them or do they not grab onto them?
One drug manufacturer, Seprecor, is developing a promising new compound, an antidepressant drug with a triple mechanism, meaning it improves the functioning of all three transmitters simultaneously. Existing SSRIs only affect one transmitter at a time. That's an exciting development for people using antidepressants. As firms like Seprecor look to the future, the real goal is a better understanding of what causes depression in each of us.
So if you could determine what those different causes are, you probably can tailor individual therapies for patients that might be better suited.
While scientists search for better forms of treatment, depression persists. For the millions that continue to suffer, the key to survival is asking for help when you need it.
Have you been feeling suicidal today?
What's been going on for you?
Okay. These are the Samaritans, a suicide prevention hotline. They wage the war against depression by answering the phone when the despairing call.
Yeah, it sounds like you are having a hard time.
Oh, I'm sorry that you're suffering.
Are most of the people who are calling, are they suicidal?
Most are not suicidal, although we assess risk on every call.
Are you feeling suicidal today?
Only about 5% are actually in acute risk when they call.
So most of them just need someone to listen to.
That's right. They've often used up a lot of their other avenues out there, and they need to talk to someone just to kind of feel some relief from their despair.
Oh, that can be rough.
Is it okay if we listen in on a call?
Please. What kind of things have you been going through? Oh. Oh. Yeah, I'm so sorry. That must be so frustrating. We get a lot of callers who use us sort of as part of their taking care of themselves. So it's not maybe the first time they've said, I'm struggling, or I'm depressed, or I have a mental illness. But we do get a lot of first-time callers who it's the first time that they've said, you know, I'm struggling with an issue in school, or I think I might be gay, but there's no one I can talk to, or I think I might have a drug problem. And I think just having someone not run away, not try to change the subject, validate what they're going through is real. By picking up the phone, we say we care, that we think they're worth something. Yeah, no, I'm glad that you do call.
What are some of the things you've learned about depression since working here?
One, that it can happen to anyone, that it can be totally debilitating, that you can hide it. We have a lot of callers who will get through their days, but are really in a lot of pain. Did you go to work today? What I've learned is that there isn't an easy answer to depression, that yes, sometimes medication helps, yes, therapy can help, yes, groups can help, but you need to sort of have people listening that really care.
Is that upsetting you?
Every 17 minutes, somebody attempts suicide. Among college students, it's the second leading cause of death. If you find yourself talking to someone who may be suicidal, there are do's and don'ts.
What stuff's been happening?
You don't want to give advice. You don't want to talk about yourself. You don't want to make presumptions. I think it's important just to let the caller take control of the phone call.
How hard is it for someone to pick up the phone and actually call you all?
I think it takes a lot of courage. I have a lot of admiration for our callers because I think they're struggling really hard and they're willing to take a chance.
Are you a little bit confused?
They're willing to open up and trust someone, even if it's just for 20 minutes, even if they don't use their name. They deserve someone to listen to them and to be there for them.
I'm glad that was helpful to you, Bob.
What's the most rewarding part of the job for you?
I think the most rewarding part is simply knowing that I helped. I know every time that I get off the phone that I've helped in some way because I've fulfilled a need. Our service is very busy. We get many calls a day, and so it's so important to be here and to be answering those calls. Oh, no, that's okay. Take your time. Who else are you going to call at 3 a.m. in the morning? They know that they can call the Samaritans, and there'll be someone there to take their call.
For most of us, depression is just a mood, part of a complex emotional cycle. But for some of us, depression becomes an illness. There are many effective treatments for depression, including medication and psychotherapy. Remember, The most important step is the first step, recognizing the need for help. For Body Invaders, I'm Kat Carney. Stay healthy.